As the COVID vaccine moves closer to reality, a campaign of what's being called contextual information is being rolled out.
The goal is to convince some reluctant healthcare workers to get in line for the vaccine when it becomes available. But as Paula Tutman tells us, there are some deep-rooted trust issues.
There is a long and gruesome history of vulnerable and marginalized humans being abused by medical science. The Tuskegee experiment, where black men were enticed, misled, and deliberately untreated for syphilis in an experiment that lasted 40 years until 1972. And then, of course, Jewish children in Vienna who were used as human guinea pigs for measles studies. And then, of course, Auschwitz. Who can forget what happened in Auschwitz? Now let's go to current history. And then there's this seemingly deliberate campaign of misinformation and, of course, ridiculous social media that spreads all kinds of misinformation. And you can understand why there are so many people out there who are unwilling to even consider taking this vaccine, particularly since it's only been in development for less than 9 months. The state of Michigan reports that across the state as of December 1st, 45 care center staffers have died from COVID-19. Another 11,844 have been affected by COVID. 3,344 patients have died in long-term care facilities, and some 15,608 have been infected, and the numbers keep going up.
We are really working to educate our team members on the aspects of the vaccine that we know about, and then to take apart some of the misinformation that they may have heard about the vaccine.
While there are former presidents ready to roll up their sleeves to receive the COVID-19 vaccine when it is released, not everyone is gung-ho. Administrators of some nursing homes say they will have some heavy lifting to do with some of their workers.
Some of it is just past history with vaccines and their fear that it's not going to work, it's not going to be effective. Other things that I've heard is there's a microchip in the vaccine. And it's like, there's no microchip in the vaccine.
It is something Michigan's elected leaders are aware of.
That mistrust is earned. Like, the Tuskegee experiment happened. And so as a black man, it's very important to me that people are able to have their questions answered and concerns allayed. So the task force is putting together a plan working with, across state government and also with partner institutions to make sure that people have a place to go to get these questions answered.
And so it's not enough for experts to agree the vaccines are safe without first proving to people that they can trust the experts. Paula Tutman, Local 4.